Good afternoon and congratulations to the graduating class of 2021. I'm Dr. Nadine Peacock. I am a faculty member in Community Health Sciences and the Associate Dean for Diversity and Inclusion. It's my pleasure this afternoon to introduce the winner of this year's Alan W. Donaldson Award. The Donaldson Award honors a graduating student who exemplifies excellence in academic pursuits as well as in leadership and service. The award is named in honor of one of the founding fathers of our School of Public Health, who was also its first associate dean. The winner of this year's Donaldson Award is Ms. Hannah Bonecutter. Hannah is an MPH student in Health Policy and Administration. She has pursued a rigorous course of study here at the School of Public Health, which included the Global Health Concentration, as well as the Certificate in Health Disparities Research. Hannah's service has been exemplary as well. She has served in leadership positions and is an active member of a number of student organizations, including Minority Students for the Advancement of Public Health, the Global Health Student Interest Group, and the Health Professions Student Council. Hannah is an accomplished actor and spoken word artist, and also a trained educator. And she has used these skills to further the well-being of women and children in Chicago as well as globally. Join me, please, in congratulating Hannah on this significant honor. Thank you.
Epidemiological what? Words unknown to a woman whose depth of exposure to science stopped at a high school chemistry class ditched often 2 years ago. Imposter syndrome. Feelings felt since grade school in gifted classes. Tan tints stand out against whitewashed backdrops. Articulation absent to describe 2 years ago. Social determinants of health. Destiny drivers I was unaware of 2 years ago. Hidden in camouflaged blind spots, but oh, so impacting. Scars prove it. Resilience pushes against it. Perseverance propelled me through demanding graduate school. Earning an MPH I never before dreamed I'd achieve. Nearly stopped by the moment of truth, one that took us all aback, shocked the world, and paused all that we came to know, you know of what I speak. COVID-19. Oh, the revelations this pandemic has offered to much of the public, truths we came to intimately understand in our graduate coursework. Truths like Black and brown people in America are often disproportionately affected by many of the diseases, injuries, and chronic conditions science has discovered. Systemic racism has a deleterious effect on people of color worldwide. Poverty often leads to chronic illness, lack of education, or the inability to work. Prisons tend to irrationally exert punishment on prisoners to the point where it counterproductively causes more harm than good. Adults with higher educational attainment live healthier and longer lives compared with their less educated peers. And the more humans encroach upon and destroy natural habitats and wildlife, the more our ecosystems are dismantled beyond repair, increasing the probability for something like a global pandemic, wrapped up in a microscopic virus, COVID-19. While dark, ominous clouds can seem to fill the sky at times such as these, understand that you are that light breaking through. Yes, this degree was grueling, at times unbearable, pounded on with the reality of a pandemic and lives lost. Some that were parts of our own, most preventable by proper public health. So what do we do now? We breathe justice. We see inclusion, we hear equity, we smell prevention, we taste cultural competence, embodiment. We embody public health. Take that cross-sectional research study and prove how we must address these linked variables that the results show. Use that built environment assessment and stop hazardous constructions and patterns from being established. Enact that strategic community action plan that improves population health in sustainable ways. Leverage that policy analysis to promulgate legislative change that alters the course of our future. Don't forget to celebrate the wins, like right now. Recognize and revel in the fact that we are the class of 2021, graduating during the very type of global public health crisis that we will work to prevent in the future. How ironic, yet simultaneously destiny-making. Ingrain this symbolic moment in your heart, mind, and soul to propel your actions and prepare your intellect. History will not forget these moments. Neither will we forget the history we are making on this day. History makers, fellow public health leaders, colleagues, congratulations. I cannot wait to see the change you make in this world. I hope you enjoyed that spoken word poetry provided to offer a bit of a break from the ample speeches we hear on this special day. While there are so many unpredictable facets of life we cannot prepare for as we might like to, one thing is for certain. This is our time illuminated like never before. Public health. And guess what? We are prepared. We have gained so many critical tools in our graduate journeys, from completing cross-sectional research studies, drafting community action plans, assessing endless data charts, tables, and graphs, and composing comprehensive policy analyses. It is plenty, indeed. All culminating to a respected graduate degree. What an accomplishment. Congratulations. Yet remember, our knowledge, research, and deeper understandings are not meant to be sheltered or kept as the status quo. As the bold and brave Dr. Linda Ray Murray declares, data and research merely for the sake of doing it mean nothing and does nothing. Unless it is used to create change, it is pointless. I believe the same goes for knowledge. Whether that knowledge is obtained through reading 1,000 books, listening to wise elders, or earning a graduate degree at a prestigious university such as UIC. As humans, we are not created to be alone and unsharing. We are social beings. The critical knowledge that we have had the privilege and blessing to gain our graduate degrees is meant to be spread, understood, used to empower, and thus result in lasting change. I recall special moments of knowledge sharing and collaboration that I've had over the course of this graduate journey. Organizing and hosting events and programs with student organizations I've had the pleasure to be a part of, such as the Global Health Trivia Night with the Global Health Student Interest Group, or the Pen Pal program of the Minority Students for the Advancement of Public Health organization. The film screening and lecture presentation event I helped organize at UIC honoring Black History Month in February 2020 could not have been done without the strategic coordination among all involved organizations, some of which included the Urban Health Program and the Black Graduate Student Association. Yet perhaps the most prominent instance of knowledge dispersal and intense collaboration occurred this past April at the UIC SPH 12th Annual Minority Health Conference. This conference promoted prevention efforts, policy developments, and culturally tailored programs through knowledge dissemination, critical conversations, and essential partnerships. In addition to serving on the planning committee, I had the unique pleasure and responsibility of also serving as the moderator for the panel discussion, which featured principal public health leaders and healthcare professionals in the Chicagoland area. This event sparked the formation of an action-oriented agenda that addresses disparities in chronic diseases, health inequities in society, and the related determinants of health that plague marginalized communities. These are the types of critical moments and collaborations that circulate the essence of public health, fostering the needed partnerships and coordination for systemic change. If you ask me, public health is the dream work. Collaborating with an effective team simply makes it come to fruition. I am so thankful and grateful to be graduating alongside such competent, striving peers that are ready and eager to be public health, not just do it. I have such deep appreciation for all of the faculty, staff, and SPH community that have made this journey extremely enriching and momentous. Thank you. So go out, be that diamond, let that remarkable light shine so that wherever you may go, whatever you may do, the positive change you make bettering our communities is unquestionable, indubitably recognizable as public health. Thank you. Congratulations, class of 2021. At this time, I invite the graduating class of 2021 to rise, if you are able, and join me in reading our school statement of values. We are a community of scholars, students, and staff dedicated to creating a healthy society. In achieving this goal, we are committed to community, the basic unit of analysis for public health, enabling communities to address their own problems, share skills, lower barriers to action, and act as a catalyst for progress. To knowledge, the pursuit, development, and dissemination of which will improve the health of the public. To professionalism, acting with integrity and collegiality in learning, teaching, research, and public service. To stewardship of natural, human, and financial resources. To idealism, whether secularly or spiritually motivated. To caring, promoting compassion for and action on behalf of others. To justice, whereby everyone is given access to the resources necessary to live a humane life and fulfill their full potential. To diversity, celebrating unique contributions to the fabric of our community. To respect, for the members of this community and for those whom our efforts are intended to serve. To humility, as we set our goals, as we work together to achieve them, and as we address the inevitable conflicts produced by those joint efforts. Congratulations, and welcome to the field of public health.